Assalamualaikum and hi everyone, we are from group 2. Today we are going to present on classification of cardiovascular diseases CVDs using data mining technique.
Nowadays, cardiovascular disease are one of the highest flying diseases of the modern world because since over the past few years, a large number of cardiac patients and high percent of deaths due to heart disease have increased over the time. Since there is a very limited amount of data available depending on this disease, thus, prediction models are needed to have an early classification of the heart level of cardiac patients. In this study, the data that has been used is from Pantai Hospital, Kuala Lumpur. So, the objective of this study is to analyze the various of data mining techniques that will be used in order to classify the health condition of the patients and determine the main risk factors that lead to heart disease. Then, the significance of this study is to help in choosing the suitable data mining techniques. Ansarullah, Sharma, Wahid and Kirmani said it is very important to analyze the healthcare data related to classification and early diagnosis of the disease. In addition, many patient lives will be saved if the main risk factor caused by heart disease can be identified first.
World Health Organization 2017 stated that cardiovascular diseases or CVDs can be referred to as several types of heart and blood vessel disorders. Similarly, according to Chowdhury and Singh 2019, CVDs also happen due to major cholesterol block or narrow blood vessel in the body. CVDs include diseases such as coronary heart disease, peripheral arterial disease, rheumatic heart disease, and congenital heart disease. Three main risk factors of CVDs consist of high blood pressure, high blood sugar, and high cholesterol level. An individual who has a high blood pressure will be having a systolic and diastolic pressure of 130 to 139 mmHg and 85 to 89 mmHg respectively. Then, high blood sugar. Risk in blood sugar level will cause the failure of systolic and diastolic pressure and can cause damages in nerves that regulate the heart and blood vessels. Lastly, in high cholesterol level. A high level of cholesterol, which a fat-like substance produced by liver, can cause the narrowing and blocking of blood vessel, which could lead to CVDs such as angina and cardiac arrest. The first type of data mining technique is decision tree. Decision tree is a model that is very close to the flowchart because every non-leaf node represents a test on particular attribute. Then, every branch represents the outcome of the test. Some of the type of decision tree is CAR and C5.0. Then, neural network. Neural network consists of three layers, which are input layer, hidden layer, and output layer. There exists correlation between every layer and weight or value that are assigned for each connection. Lastly is regression. It is used to find correlation among different variables. There are three types of regressions, named as simple linear regression, multiple linear regression, and logistic regression.
Different classification performance metrics are used to predict the risk level of each patient. Classification accuracy refers to the ratio of number of correct predictions to the total number of input sample, and there is area under the curve, which can be used to measure of the ability of classifier. The stable operating characteristic is a graph showing the performance of a classification model at all classification thresholds, and the curve plots at two parameters, which are true positive rate as a sensitivity and false positive rate as a specificity.
3 sample collections consisting of CVDs patients record were obtained from the cardiologist department of PHKL. Next is regarding the research process done in this study, which comprises of 4 stages. The first stage is pre-processing, where in this stage 23 outlier data has been removed. Hence, a balance of 280 data will be further used in the data analysis. Then, second stage, data transformation is carried out as all the string data cannot be directly analyzed in the IBM SPS statistics software, thus need to be converted into numerical data. Stage 3 discusses the model development, where there are 8 popular approaches that have been chosen to be used in this study. Besides, train test split procedure, where the training set contains 70% of total data was used to evaluate all the models. Thus, a model with higher CA value will most probably chosen to be the best model.
All the 13 independent variables were ranked using the orange software. The top 3 variables indicated that this variable will highly influence the symptomatic patient are tau, chest pain type, and number of colored vessels.
5 different evaluation techniques such as CA value, sensitivity, specificity, AUC value, and the misclassification rate have been used for the purpose of comparison and evaluation of performance for all the 8 models. This table summarizes the statistical evaluation criteria utilized for the effectiveness testing of all the proposed models for the determination of the best model in classifying and predicting the CVDs. From the table, it is clearly seen that neural network obtained the highest CA, sensitivity, specificity, and AUC value compared to other models. In contrast, Check Decision Tree obtained the lowest accuracy and AUC value. Besides, logistic regression has the lowest error rate of 9.5238% and followed by neural network with value 11.9048%. The worst result with the highest error rate of 40.4762% belongs to the KNN model. In conclusion, by evaluating and comparing all the 5 different criteria, it is undeniable to say that neural network model will be labeled as the most significant method in this study, as it is clearly seen that this model generally shows a better result in all the statistical parameters. Hence, it is the best model and will be further used for the early prediction of CVDs.
The table represents 2 data of the patient that went through the cardiology test to identify their health condition. From the table above, the first patient is classified as sick, then the second patient is classified as healthy. Therefore, this prediction is made using neural network by using orange software, and the condition of the patient has been classified correctly. This study has developed 8 different types of models. The training set take up 70% of the data, while the test set used the remaining 30% of data. Throughout this study, it has been proven that neural network is the best model compared to other 7 models in terms of highest CA value, AUC, and the best sensitivity and specificity results. Therefore, neural network has been chosen as the most suitable data mining technique to classify the health condition of the patient.